Hi, this is Elizabeth Harrington from Public Opinion Strategies. As Brian mentioned, we conducted a national telephone survey among registered voters in July on behalf of the De Beaumont Foundation. This is a track of some core key questions that we had conducted in a poll on public health, and a national poll that we had conducted also in 2018. And so this is a look 2 years later at where attitudes are on public health. You can go ahead and change to the next slide. Before we get to the findings of this poll that we did for the De Beaumont Foundation, this slide we have in here is just to show you some perspective in terms of where attitudes are among the public about what are the most important issues facing the country. This is from work that my firm has released in August. It was a track that we had done for Gerard, another communications firm, in April. And as you can see, in terms of the top issue facing the country and what voters are most concerned about, it's still the coronavirus, and by large margins. Even when we're in a political cycle and there are other issues on the table, the coronavirus is still the main, most important issue that people are focused on. You can go ahead and turn to the next slide. So moving on and looking at the De Beaumont poll that we did in 2020, as I said, this is a track from 2018. So we're looking at how attitudes have shifted on public health. The coronavirus is clearly having an impact on how voters' perceptions are about those healthy communities and the importance of public health departments. You'll see when we get into the detailed charts and the analysis that public health departments are viewed as having a more important role today in creating healthy communities than they did 2 years ago. In addition, there's an increased importance on preventing the spread of disease. But it's important that that hasn't taken away from support for other services that public health departments offer. And voters continue to value all of the services that public health departments offer. In this research will also show you that a majority of voters still say they would be willing to pay more in state and local taxes to increase funding for local public health departments. That's risen slightly, but just above the margin of error since 2018. And familiarity with public health departments is up since 2018, where people are saying they're more familiar with their local public health department. But what's important, I think, as we get into what Matt's going to talk about and some of the communications that public health departments should be doing, there wasn't very much movement on the very familiar percentage, which means that there is still room to grow and for public education on what public health departments do and the services that they provide in communities. You can go ahead and move on to the next slide and the next slide. So one of the things that we did in the survey and that we tracked from September 2018 to July 2020 is we had voters rate the importance of public health departments in creating a healthy community. We use a scale of 1 to 10, where 1 means not at all important in creating a healthy community and 10 means very important. You can see from the data from 2018 to 2020, today more than 7 in 10 voters now say that public health departments are important in creating a healthy community. And the very important percentage rose from 27% to 42%. So these are large jumps. And as I mentioned, it's clearly due to the time in which we did the poll, and obviously that we're in a public health pandemic. You can turn to the next slide. So there's a lot of data on this slide, so I'm going to highlight it and kind of the key points. What we looked at from 2018 to 2020 is the percentage of voters who rate the importance of public health departments high in creating a healthy community, meaning it's very important. On the left-hand side is looking at the percent rating at a 10 on that 1 to 10 scale. On the right is looking at the percent who rated an 8 to 10. And you can see if we look at those that are rating at a percent 8 to 10, We have the all voters percent, which was a plus 17-point rise, but you can see kind of some of the key audiences where the importance has significantly risen from 2018 to 2020 are white men, men college plus, Republican men, strong Republicans, whereas in 2018, they did not see the value or importance of public health departments. Today, majorities of those audience and significant majorities are saying that public health departments are very important in creating a healthy community. You can go ahead and turn to the next slide. So these next few slides are going to be looking at the percent 10 in dark blue, the percent 8 to 10 is the total. And this is, again, the rating of importance and showing you the rise in the importance ratings. So across party and across ideology, the importance and value that public health departments have in creating a healthy community has risen sharply from 2018 to 2020. You can turn to the next slide. And this is true across socioeconomic status as well. You can see there are differences when we're looking at how people classify themselves. That's the poor, working class, middle class, upper class, well-to-do. We have them self-report how they would qualify their economic circumstances rather than looking at income in terms of how they feel they are economically off. And you can see that the importance of public health departments is a bit higher among those in middle to lower income households. You can turn to the next slide. And again, we just want to show across gender, age, ethnicity, the significant rises that you see in the value really across all voter groups in terms of how important they believe public health departments are in creating healthy communities. African American, Hispanic, non-white groups always, in our past research in 2018, had rated the value as very important. You can see they were at 76 in 2018, they're at 79 now, but this growth is really coming from all voter subgroups and audiences. You can go ahead and turn to the next slide. And this slide is showing again what are the groups that really value public health departments the most. And so we're looking at the people who rate public health departments the highest in terms of their importance in creating a healthy community. And it's African Americans, Hispanics, women, those in lower socioeconomic households, and those living in urban areas, younger voters, and Democrats. You can go ahead and turn to the next slide. So this goes to the point that I mentioned earlier, where I don't know what just happened with the slides. Okay, so they're back up. This goes to the point that I mentioned earlier, where how familiar people are with their local public health departments. We asked a question and asked them to say whether they were very familiar, somewhat familiar, not too familiar, or not at all familiar. You can see the rise in familiarity due to the situation that we're in today. But what the point I think that's very important to make here is if you look at the intensity and you look at those that say they're very familiar, in 2018, that was 15%. In 2020, that's 17%. So there hasn't really been much of a shift in terms of how familiar people are with the services that public health departments provide and how familiar they really are with them. But obviously with their local public health departments in the news during the pandemic, the overall familiarity has risen significantly since 2018. You can go ahead and turn to the next slide. And those groups that report being most familiar with public health departments are consistent with those groups that I mentioned before who value public health departments the most in terms of African Americans, non-whites, urban residents, women, Hispanics, Democrats, And so you can see that there's a theme here in terms of people who are familiar with the departments most value the departments as well. You can turn to the next slide. We tested, and you'll see this in a bit in the next few slides, but we tested a series of services that public health departments offer in communities. And after hearing the list of services that public health departments offer, we asked voters whether they would be willing to pay more in state and local taxes each year in order to increase funding to ensure that every community in their state, so we inserted their own state, receives all of the public health services from their local public health department. You can see that the percentage of people who are willing to pay more in state and local taxes annually has increased slightly above the margin of error, but that we now have, we still have a majority, 6 in 10, who say they're willing to pay more in taxes to make sure the local public health department services are available to everybody. You can move to the next slide. And the next slide. So we've divided this up across some different slides, but these are looking at all of the different services that we tested and asked people about in terms of things that their local public health department could do in their community. And for each item, we had them individually rate how important it was to them personally that their local public health department provided that service in their community. So we have 11 public health department services that we tested. All 11 of them are viewed by voters as being important for public health departments to do in the community. If we're looking at both the percent, if we're looking at the percent 8 to 10, you have majority saying all 11 are important. And the most important service, not surprisingly, given the pandemic that we're in and the coronavirus, that the most important service continues to be helping stop the spread of communicable diseases in communities. We did split sample that question here in our track in 2018. We had not mentioned the coronavirus. Obviously, and given the situation today, we mentioned the coronavirus. There is a little bit of a difference in intensity when you look at the percent 10 who are rating the importance of that service. But overall, the top service from 2018 to 2020 is helping stop the spread of communicable diseases. You can go ahead and turn to the next slide. So this is looking at those services that we tested in 2018 and 2020 in terms of the movement and shift in the percent 10 rating. So importantly, none of the public health services dropped in their level of importance since 2018. And these are the items that received higher importance ratings in 2020 than they did in 2018. Importantly, providing critical unbiased information on how to respond and what to do in a crisis, working together with the broader healthcare system to address problems before they become health crises, reaching out to people that are at greater risk of having poor health outcomes, and working to improve local community services, supporting women and children's health, and establishing prevention programs. You can turn to the next slide. So these are the services where the ratings were consistent from 2018 to 2020 within the margin of error, that we didn't really see much movement in terms of ratings, in terms of importance. You can turn to the next slide.